mom. I miss my mom. I really wish I have her around at least.
Everybody, so I came across this video on King Tunde Ednot's page, and it's so heartbreaking, it's so sad. She was literally crying so bad, and I just felt, let me do a short video about postpartum depression. So what is postpartum depression? Postpartum depression is actually a mental health challenge or condition that affects a lot of women after childbirth, and it involves feelings of extreme sadness, anxiety, and exhaustion that can actually interfere with a mother's ability to care for herself and her baby. There are several factors that can actually contribute to PPD, which number one is hormonal changes. After childbirth, there is a very significant drop in the level of estrogen and progesterone, which definitely contributes to emotional instability, affecting mood regulation. Another common one is sleep deprivation. New mothers often experience disrupted sleep patterns due to caring for the newborn, leading to exhaustion. Another one is physical changes, which comes from recovering from a difficult birth, maybe cesarean section, or some people having breastfeeding challenges can impact a woman's emotional well-being. Another factor is feeling of inadequacy, lack of support, or overwhelming responsibilities for caring for the baby and for yourself can cause emotional strain. And another one is previous mental health history. Some women have history of depression, anxiety, and other mental health issues. And with this, increase the risk of PPD. Then social factors, lack of support from family, lack of support from friends and partner, as well as stressors, which can be financial difficulty, can be a lack of community. All this can actually increase vulnerability. What are the symptoms of PPD? Number one, persistent sadness or feeling of hopelessness or irritability. Another one is difficulty bonding with the baby. Another one is severe fatigue. Even after resting, you're still feeling fatigue. Then feeling of guilt, of worthlessness. You have trouble concentrating with making decisions. And then when you are having a thought of harming yourself or harming your baby, you need urgent help. You need to seek help immediately. You don't waste time. When it comes to that, you need urgent help. How do we handle postpartum depression? The first thing, you need a therapy. You need to see a good counselor. You need to see a good mental health therapist, because there are things they need to do for you, like a CBT, cognitive behavioral therapy, like interpersonal therapy. They need to do all those things. It can greatly help. Another one is medication. You may need to take some antidepressants like selective serotonin. Please see your doctors for that. Other ways to handle PPD is to build a support system. Lean on supportive family members or friends, or even your partner. Another one, consider joining a support group where new parents interact and share their experiences. Another one, self-care. You need to learn to sleep. Find time to sleep. I used to tell people, make sure you program yourself in such a way that when your baby is sleeping, that is when you are sleeping. When your baby is awake, then you are awake and you are energized. But when baby is sleeping and you are doing something else, by the time baby is awake, that is when you feel like you want to sleep. And all these things coupled together are the things that are bringing this feeling of depression. So first thing first, self-care. Make sure that you program yourself to sleep when your baby is sleeping. Another one, please mind what you eat. Your nutrition is very important at this time. Make sure you are eating a well-balanced diet, because it helps stabilize your mood and provides you the energy you need. Another one is physical exercise, physical activity, even as simple as taking a walk. It helps. Then practice mindfulness, practice relaxation, engage in activity that promotes relaxation, such as meditation, such as deep breathing exercises, or even yoga. This can greatly help you come out of that depressive feeling. Another thing that's very important is that you need to set realistic expectation. Adjusting to a new life now that you are a mom, it's kind of a little, difficult. So it is okay for you to ask for help. Don't just be, you want to be the superhero, you want to do everything all by yourself. If you have people that can help you around, don't be too shy to ask them for help. Seek help. It helps a lot. And then talk openly about it. Tell people that matters how you are feeling, what you are thinking, what is going through your mind, how you are feeling in your body. Talk openly about it. When you talk about it, you can easily receive help. Now, this is where it gets very, very dangerous. By the time you start to feel like hurting yourself, when you start to feel like harming yourself or harming the baby, the level of your depression has gone to, need to seek help immediately. You need to speak out immediately and seek help. You're not mad, you're just depressed, and it is not something that is out of normal. But when it gets to a level, when it ascends to the certain level of you thinking of just ending it all, we have people that have committed suicide because of postpartum depression. So when you are feeling that, please seek help. Talk to your doctor, talk to people around you, and seek help immediately. Postpartum depression is a serious condition, but is a treatable condition with appropriate support, with appropriate therapy, and sometimes medication. It's vital to recognize the signs very early and reach out for support, as mental health is just as important as physical health, especially during such a transformative time. So to anybody out there going through postpartum depression or any kind of depression at all, I know what you're going through and I can relate very well. So it is important for you to seek help. I'm sending you all my love right now, but please seek help, and because your mental health is important and your life is important, the life of the baby is important. So we need you around, your baby needs you, we need your baby. So please, it is important that you get out of it as quick as possible, and try get all the help you need. Love you. I wish you quick recovery, and I'm wishing you all the love, all the support you need right now. Bye.